Welcome back, everyone. Today we are doing a new series called Application Revealed, and this is where we give you the inside scoop into applications that were successful in many different ways, and we're going to talk about what we think made them successful. If you like this type of content, please like and subscribe, and we'll be producing more videos like this. And please leave us a comment letting us know what else you want to see. So today I have Lauren with me. Can you introduce yourself?
Hello, my name is Lauren, and I am currently a MD PhD student at UNC and working for Moon Prep. And I helped Arlene with this student and worked a lot on the essay part of it and writing secondaries.
So I'm super excited because this is probably one of my favorite students of all time. And I was very excited because she got into an Ivy League school. So let's first take a look at her profile here. So this is a female who is from California. Honestly, I think one of the things about being from California is that you are very limited in your school choices because all the UCs and USC are hyper competitive. Everyone wants to go there. These are like the top tier research programs. And honestly, she is originally not from California. And we kind of had a debate whether she should pick her residency in California or outside of California. But ultimately, she went in with California because she felt like she wanted to stay there. And a lot of the UCs, believe it or not, actually have a California preference, which I was kind of shocked to find out. So she is a first-time applicant. She does not identify as Hispanic, Latino, or of Spanish origin. She is not underserved, not disadvantaged, and she is not a first-generation student. She also went to Dartmouth College, where she majored in neuroscience with honors and minored in women's gender and sexuality studies. And so one of the things I think was very interesting is that we often see, you need perfect grades. You can't like fail or withdraw from anything. But here we actually see one course withdrawal. If I remember correctly, this was in OChem. And so typically we do think that that is a really big deal, but in this case, she was still successful regardless. She also went to Harvard as part of an extension program. I don't quite remember what she did at the extension program, but I know that she took a couple courses there. And then for language, honestly, I feel like this is such an underrated part of the application and no one ever really talks about language, but she put 3. So she put English, Hindi, and Spanish. And we'll talk a little bit more about the Spanish part, but I feel like that was actually a huge part of her application. The big question that everyone always asks me is, what grades do I need to get into medical school? And you and I are both med students. When you applied, did you feel like there was a lot of pressure for your grades?
Definitely. I think going throughout undergrad, it was definitely an expectation to have a 4.0, 3.9, and like 3.8 was like the, kind of you're cutting it. So I think, GPA is important, but even if your GPA is not all there, there's still other parts of the application that can make a strong application overall. And we'll go into those parts.
That's actually how I feel too. I actually talked to a consulting company when I applied, and they were like, we don't know if you're going to get in. And I also had a 3.6, right? Which I was like, I felt like I worked pretty hard for this. And I was kind of surprised. I mean, I guess I wasn't that surprised because in my mind, a 4.0 is like, you should be able to get in like anywhere. And, if you're like closer to 3.5, it's like, maybe your chances are like 15%. And that's kind of the picture that they really painted for me. And, I feel like nowadays, like we're not really like seeing that. Like I feel like the emphasis is so much more on your activities, more so than your GPA and MCAT. But at the same time, like, it is important as well.
Mhm.
I guess it really depends on where you apply. So for grades, we see that she has a 3.61, and her MCAT, she did take it twice. The first time she took it, she got a 512, and the second time she got a 514. So these are pretty good. We always hear you need like a 520, right? Or, a 524 to get in. And especially in something as competitive as the Ivy Leagues, I was pleasantly surprised by this application, and especially because she didn't identify as like, URM, or had like a really, like a big sob story, right? I felt like her application was like just pretty true to herself. And so it was kind of interesting to kind of see the results come back.
URM meaning underrepresented in medicine.
Yeah. Yeah. For preview, this was kind of the new exam from AAMC. So a lot of people like don't really know about it. I feel like the best way I could describe it was kind of like Casper on paper. Like you go through different situational problems, but I think it's scored out of 9. So she actually did really, really well.
Yeah. I wanted to mention in regards to the MCAT, if you're thinking about taking the MCAT twice, it's really important for the score to go up if you do think about doing that, just to show that improvement and that putting in the extra time and taking it again, you can achieve improvement.
Yeah. So let's take a little bit of a deep dive on her grades. So her freshman year, she got a 3.5. So not bad, but not stellar, right? And we see in her sophomore year, she did a little bit better. And then junior year, she just killed it. Like she got a 3.76. But then in her senior year, this dropped. And so it was kind of interesting, like doing advising, because I focused so much more on like the overall grade. And I was like, this is perfect. And I didn't really look into each individual year. But when they look at admissions, they actually do this. And so now I do ask people to tell me what their averages are per year. And even if you start not super good, right, because you're trying to transition into college, if you at least show an upward trend, they do consider those things as well. So we can see here, her freshman to her junior year, she's doing so much better. She is obviously going to be taking more rigorous classes, but she's been able to keep up. And not only that, she was able to succeed. And I asked her, what happened in your senior year? And, this was like during the time of COVID, and it was like, transitioning onto online and then retransitioning back into the classroom. And so, I think part of it was like they did some pass fail, but then some were not. So there was just a lot of confusion overall. And one of the inside scoops we got, so she actually applied to USC, and USC took a look at this. And what do you think their impression was of all the scores we're looking at?
Yeah, I think, showing the upward trend is important. But when you see that dip in the junior to senior year, it can make you definitely wonder what's going on there. And is there something we should be concerned about?
Yeah, so that was one of the things that they pointed out that I hadn't really considered too much, especially because everyone says your junior year is so important, right? And part of the reason why her grades are a little bit lower is because she took so many classes for junior year and she took less her senior year. And so 1B, because you're taking less classes, the averages just automatically drop a lot, right? But the weird thing that USC said about this application was they thought it was weird that she retook the MCAT at 512. Now, it's kind of notorious that USC really likes people who get over 515. So I was like, wouldn't they want her to do better, right? 514 is so close to what the averages are, but apparently they said that it was weird decision making. And, does every medical school think this? I don't think so, because in the end, she got quite a bit of interviews, and I don't think that hurt her at all. But it was just interesting to hear that from like one of the major universities.
I think that's an important point to show that each school has different decision-making, thinking processes, and can look at applications in a different way. So if you're not a fit for one school, you could still be a fit for another school.
Okay, so let's look at the rest of the primary app. So for her experiences, she listed up to 15, and I can't quite remember. I think you are only allowed 15, but you don't have to use them all. I think most people have around like 8 to 10. And I think that is a pretty reasonable amount, but she was very active in a lot of different things. And she wanted to be able to showcase that. So she ended up using all 15 slots. So one of the things that we talked about when we first met was volunteering, and she didn't have as much volunteering as other people. Oftentimes I think volunteering is like such a big component. And it's weird that I say that, because when I applied, I think I had like not a lot of volunteering hours. Like I think I had less than 30, because I spent all my time doing research, right? And so I feel like that just really says like there's not really one thing or another. And she is very research heavy, which we'll kind of go through. But one of the deficits that I felt like, especially because we were starting a little bit earlier, I felt like she had the time to supplement. And so I was like, why not do more volunteering? And so I think that's where the hospice came about. It was more of a recent thing. So you could see she only spent 5 months, but she did spend quite a good number of hours in that one as well. Her next one is kind of similar, a newer one that she actually really enjoyed. So, one of her big passions is women's health. She really resonated with, the people that she met at the women's shelter, like getting to know their stories. And that's something that we really try to write about and kind of bring out a little bit more in this application. And even though she didn't spend, years at the shelter, right, we were still able to show that she did something meaningful.
Something else to note is that it's important for an application to have a cohesive story that runs through the whole thing. So we'll get to her personal statement later on, but there's a theme throughout her application, and volunteering at the women's shelter shows her interest in women's health. And that comes up again in her application. So that shows consistency and that her story is making sense.
So this was kind of like the big thing in her application, right? So this was done in her gap year. So she worked as a clinical research coordinator at Stanford. And, we talked about how she got a promotion. She was working here full time. So that's why the number of hours is so much. And I think one of the things that surprised me the most is that this is not her most meaningful.
Yeah, sometimes people think that the number of hours that goes into an activity make it the most meaningful. It really is important to evaluate what is most important to you personally, and that'll come through in your essays. And so it's important to really reflect on what is the most meaningful to you.
Yeah, she was very adamant about staying true to herself. And she was like, even though she's like, I love my job, I love my mentors, I love working here, she's like, I just feel like I am not the biggest research person. Even look at the number of hours, right? She spent a whole year doing research, and this is not her only research experience. And I think that was what really shocked me, because I think most of the times, like, you kind of pick the most recent thing as your most meaningful. When I applied, I definitely put my job as my most meaningful, but at the same time, like, it was my most meaningful experience because I did a lot of like random stuff, right? But I felt like I really grew as a person in those things. And so as an undergrad, she did her neuroscience thesis. And once again, she did a lot of research. She spent a year and a half on this, a ton of hours. And, again, I'm always surprised by the things that she picked. And I think you'll also be surprised to see what she designated as one of the most meaningfuls. But she spent a ton of hours doing different types of research. She's very into neuroscience, but she has a lot of different like clinical interests as well. And I felt like that was one of the things that, we ended up showcasing a lot, is that, she is very passionate in what she does. And I felt like it was actually like a true testimony to what she's passionate about and what her clinical interests are going to be in the future. So what do you think about this one?
Yeah, I think that it can be, it could be controversial to put a sorority experience on an application, but I think it also is an opportunity to showcase her personality, her values, her interests. And this is an activity that she spent hours doing. And it could be something that she writes about in her essays. And so I think as someone who's looking at this application, I might be interested in what kind of activities she's done through this position and what kind of experiences she might have learned from by doing it.
Yeah, and that's such a good point, because that's exactly what we talked about. So we talked about this quite a bit, and she and I kind of went back and forth on should she include this or not. And I was like, I'm only okay with you including this because you're going to talk about your leadership, right? And she talked a lot about community building within the sorority, and I was like, okay, I'll give it a pass, because I read a lot of like resumes and applications for like different types of things, and I'll see people with sororities stuff. And I mean, I'm not going to lie, sometimes I look them up on like Facebook or Instagram, and I'm like, oh, this is a little questionable, and I'm seeing things I shouldn't see. And so, with social media and, especially more controversial things like Greek life, you have to be really careful and make sure you're painting it in the best light and showcasing something that is going to be a valuable skill to them and not a threat. This was another one that I personally felt like being a TA was not super meaningful, but we ended up talking about some of it in the supplements, I think, right?
Mm-hmm.
Yeah. So she talked about like how it was kind of difficult for her to learn some of these topics. And so she really wanted to create like an environment to teach people and really help them understand things that were like really complex. And so she spent a lot of time trying to figure out ways to teach things better to other people. And that was something that she felt like was really important to her, even though it's like not a most meaningful. We went back and forth on whether she should include this in her supplementals. And, being a TA is great because it does show leadership, and that you're able to teach something, and you have to be able to master that concept before you teach. But, I was kind of wary because I felt like we had a lot of better experiences that she could have definitely pulled from, but she really wanted to showcase what she did in that, as a learning fellow. So she talked about how she spent a lot of time creating lesson plans that she felt like were going to be more effective. And she said that she had a hard time learning some of these different topics. And because a lot of people are kind of quiet, right, and a lot of people don't like to ask questions, she wanted to make sure that she created like an inclusive environment, right? So it kind of follows that theme similar to the sorority, where she talks about like building a community and building something that is open and inclusive. And so why is that important? it's important because in a doctor's office, that's exactly the type of environment that we want to create. And so even though these two things are not necessarily related, she was still able to draw from that and talk about how it influenced her goals in the future.
Yeah, a strength in when you're thinking about what to include in your activities, thinking about what skills you have learned from an experience or what skills you have taught can be helpful. And if this was an experience where she just showed up and did her job and then went home and didn't really get much out of it, then that might be something where it's not necessarily meaningful enough to include on your application. However, if you do go above and beyond what's expected of you and putting in the effort to help other students and make their learning experience better, then that can be something where it's meaningful for the admissions committee to know about that and showing how you take initiative.
So next is another research, which is her neurobiology. I don't quite remember what she did for this one, but again, she spent a lot of hours on this. And I think this was actually different from her thesis as well. If I remember correctly, she did 2 neuroscience research at Dartmouth. And then I think there is one more that she did as an intern. And then she did her Stanford research. So I was just a little bit surprised that none of these research made it to the most meaningful. This one is one of her most meaningfuls. Is that something that surprises you?
Yeah, I think this is definitely a surprising choice. When we look at the hours, it's less than some of the other activities that we've seen. When you look at the experience name, peer mental health advocate, just from looking at that name alone, we don't necessarily know what level of leadership she partook in this activity. It's something that might not be well known to many people, whereas, research experiences, we can kind of understand what you might have done in that role. So it could be a little bit, risky to choose something that seems less meaningful to others, but because she had such a conviction about choosing this as her most meaningful, it really comes across in her writing when she's so passionate about it.
I think that's such a good point. So we spent I think probably an hour talking about what to choose for this most meaningful. And I was like, I'm not convinced that this is going to be that important. And she was like, no. She's like, Darlene, I have to put this in. This is very important to me. And I was like, are you sure? You don't want to pick Stanford? And she's like, listen, I love it. She's like, I feel like I'm just not that passionate about neuroscience. Right. And I was like, okay. So, so she talked about the culture at Dartmouth. She described it as very work hard, play hard. And it definitely affected her mental health the first couple years as she was trying to figure out what the best way to balance was, right? And that was one of the major themes in her entire application, was really finding the best way to balance her personal life with all of her academics and her career ambitions. And so with the pure mental health, she said it was so hard for people to get any type of help that they wanted. So she actually went and she talked to, I think, counseling services, and she created this advocacy group, I guess. And basically, she recruited different students who wanted to participate, and anyone could call in at any time and have someone to talk to. And she was like, this was so much better because, having someone to talk to and the accessibility to that was significantly improved. And this is something that they continued even after she graduated. And you could tell the distinction from, when she was a student and didn't have any counselor appointments available to her, to creating this whole initiative where now anyone who is struggling has help. it really does paint a good story about a lot of different things, right? It talks about her leadership, her proactiveness, her creativeness, advocacy, and these are all skills that people look for in a doctor, right? Do I let people write, I am a good leader, I am organized, I am proactive? Absolutely not. I don't let people use those words, but just through the story, especially in the most meaningful essay, I think it was very well portrayed. And anyone who reads the story can see that she's very passionate about this. And, again, it adds into another major theme that we talked about creating community, right? Doing something to help out different people in the Dartmouth community and uplifting them. And this is a big, big story in both her activities, in her personal statement, and even in the supplements too. What did you guys write about in the supplement?
Yeah, so she talked about this experience, and it was a lot about learning from other people and learning from communities that are different from her own. And I think that is so huge and key in everyone's application, because as a doctor, you're going to be working with people who are different from you. Admissions committees want to know that you are going to be able to be open-minded to work with others. And so she's able to learn from others while teaching them.
So this experience was so interesting when I first talked to her. So she didn't have a lot of clinical experience, and that was something, again, I really pushed for, right? I was like, you have a ton of research, but the volunteering, the clinical experience, that's something that we want to continue to build, because, how are you going to say you want to be a doctor without ever experiencing what being a doctor is like? So when we started talking about this, public health is not necessarily medicine, but it's medicine adjacent. It's very, very close. And we talked a lot about different stories that she, based off of her experiences of working with these kids. And she talked about working with underserved kids, with parents who are all immigrants. They don't speak any English. They mostly spoke Spanish, I think. And that's where the language part came in, right? So earlier I talked about why language is so underutilized. And that was like a huge trend that I saw this year was languages is such an important component, especially Spanish, right? So, we often hear like underserved, underrepresented. What do those words even mean? So with being able to speak the same language as someone already breaks that barrier. And that's something that we talked a lot about here. And so she talked about, she was able to help people with their forms. She was able to help them understand different foods and what healthy foods is like. But she made a very clear distinction about not overstepping boundaries, especially when it comes to food, right? Like if someone told me I could not eat Asian food anymore, I will probably die. Like that is like, I would sooner give up my phone before I give up like Asian food. I'm like, no one talk to me. I just want to eat my noodles. And, so food is so ingrained in every single culture. And she's like, who am I, to tell someone else, they can't eat an empanada, right? That's the food that they grew up with culturally. So she talked about, again, balance. She talked about being able to balance, understanding their culture with trying to make a healthier decision. And, it wasn't about removing all of these unhealthy foods. It was more about replacing them with different modifications, right? So you can have an empanada, but you can make it like with a healthier version. And a lot of these kids were very excited to be kind of hands-on involved in learning how to make healthier choices. And she spent a lot of time talking to them about, how to incorporate exercise. And I think one of the most interesting parts of these stories was that these kids actually went back and taught their parents, right? So it wasn't just, trying to instill these values in the kid, but it was about making, small modifications to the entire family to help them live healthier lives. And that's what medicine is all about, right? You can't ever force someone to do something. So like in interview prep, I hate the word convince, right? You've heard me say that multiple times, but it's about, educating and guiding them. And, even if you can influence one person, right, you don't know how many people they're going to continue to influence. And it's kind of like a domino effect. So this next one was a mentorship for one of the kids, not in Dartmouth, but it was like in like the surrounding community of Dartmouth. So she was paired with I think a child who had a really hard home life, and she was able to connect with them. And, at first I think they were like really shy. And she talked about how she kind of approached this with a lot of patience and trying to break down barriers and trying to find some common ground. And once they were able to find that common ground, then they were able to have a longer lasting connection. And she even said, like, to this day, they actually still keep in touch, which I thought was really sweet. So this is something else that was designated as the most meaningful. What do you think about this one?
Yeah, I think this one also surprises me. Being that it's, not really a healthcare related activity. It's not necessarily something, that I might initially think is highlighting her strengths in her application. But again, I think it all comes down to how you explain what you got out of it and why it's meaningful. And that's why they give you a section to explain more about the most meaningful activities.
Very rarely can people convince me that a dance team is their most meaningful activity, right? And I keep going back to the Stanford one, but I'm like, how are you going to pick a dance team over researching at Stanford, right? Like everyone wants to do that. And, I feel like a dance team is more of like a side hobby that you just like enjoy doing. Like it's not like, I mean, I also did dance, but I just never like considered it like a real activity. It was more just something I did, one, to be outside, and then two, to just like, I guess more of like a stress relief thing. But again, she was very adamant about putting this one in. And, the more I talked to her, the more I was like, okay, this actually like makes sense. And, most people are like, it's used to like keep in touch with my culture, which I understand. But for her, it was pretty different. So she was, I think she was like the captain or the leader equivalent during COVID. And they weren't allowed to see each other, right? I mean, can you imagine like 30 people getting together during COVID? That was like a big no-no. And so she was trying to figure out like, how else can we keep in touch and continue like dance rehearsals during COVID. And so it was a lot of like trial and error, but they would get on Zoom and do a lot of these dances together, which I thought was like really cute. And again, it really fits the whole community, like building community theme. But not only that, she wanted it to be really inclusive as well. So if I remember correctly, she said that this dance team was primarily women and just mostly South Asian women. And she was like, why does it have to be like that? So, when she was in her leadership position, she actually opened it up to anybody, right? So this included men, this included people from different cultures. And, she said one of the most interesting things was that people loved it. And they were like, I never knew how fun this was. she had someone with a Turkish background who really enjoyed, doing Bollywood dances. And again, it was more about like being able to connect with other people through dance more than just connecting to her cultural roots, right? That was one of the factors. But again, I feel like that's such a generic thing to talk about. Like, I'm going to do something to connect to my roots. It's like, yeah, okay, that's like not the most interesting story. But I think for her to showcase like what she did in her leadership position and making those positive changes, I feel like that is what made the story really impactful. How about this one? What do you think?
Yeah, I think first, just looking at the title, it doesn't seem as important, and kind of thinking back to the sorority one, thinking about social media, these can be controversial topics, especially, what is going on the social media and, why is this important? But I think that showing how many hours she spent doing this, she was doing it for a reason and because it was something that was important to her. And if I remember correctly, I think we did talk about this in a few supplemental essays as well.
Yeah, she said I think this was one of her favorite things to do, like non-academic stuff. And I mean, I totally get why, right? Like I'm on my phone all the time. But she said she wanted to create really fun, interactive, kind of like BuzzFeed listicle type of articles that were just not serious. And so even though, she's working for like the Dartmouth like newspaper, she wanted fun, creative ways to do this. And I think one of the most surprising things is the effect that it got, right? So she was in charge of the Snapchat. And I was like, okay, how many followers did you get? And, I like expect maybe a couple thousand from like students who like follow. And it was like 500,000 people like followed the Dartmouth Snapchat. So that means the reach was like very wide, right? It wasn't just Dartmouth students. It was a ton of other people who I don't know how Snapchat works really, but people were able to find their Snapchat and follow them. So I thought that was really interesting.
And it's nice to show a different side of your personality and show what do you do for fun, and that you're not just a person who's so laser focused on only one thing, and that you get stuck on only talking about things that are related to medicine or healthcare, but showing that you have a wide variety of interests and you're willing to go out of your comfort zone and try something new or creative.
So yet again, another research thing that she didn't highlight. I actually don't remember if she talked about this in her supplemental.
I don't think so, but I think that showing that she is interested in women's health as per one of the first few activities, and it coming up again here, it's kind of that reoccurring theme that I was mentioning before. And I think the fact that she does have quite a few different research experiences, even though she hasn't said any of one of them was her most meaningful, I think the fact that she has engaged in so much research almost speaks for itself. So even though she hasn't marked it on this application as meaningful, it is clear that she does have a strong interest in research.
Yeah, absolutely. We did talk a lot about the Stanford research just throughout the application. I think it makes an appearance in the personal statement, which it makes sense, right? You don't want to talk about the same things in your personal statement as your most meaningfuls or your supplementals. And so it's almost like a puzzle piece, like, those like design boards, like I feel like that is like in my head all the time where I'm trying to figure out like, okay, how do we piece all these things together to make a cohesive story that is going to be different from your activities list, that is going to be different from your supplementals, right? Each part should speak to a different thing that you experienced or you did. And so there were some overlaps, like the public health internship. I think it made like 2 or 3 appearances, right? But each one had a different purpose and it talked about a different story that she experienced. So I think if you read it, they almost even sound different. So this was one where I don't think it's bad per se, but I was a little like, if we are going to include this, I want to make sure they don't get confused, because what is your first question in the interview going to be? It's going to be, why not dental school? So, we didn't really highlight this a lot. We kind of took more of the patient care aspect from her work in dentistry and applied it to, what she plans to do with patient care in the future. So, a lot of the application stuff is all about framing, right? As long as you frame things properly, you can really put anything in there.
Absolutely. And I would also say, in terms of framing for this one, she could say that she did experience, what dental care is like. And maybe even though she did spend a good amount of time there, going through that experience, she learned that's not for her, and it was something she doesn't want to do. So I think it's totally okay to go through different types of healthcare experiences and kind of explore those pathways. And if it ends up being something that you realize you don't want to do, that's also valuable knowledge.
So this next one, she kind of just threw all her awards and honors and publications together. And I like that she did that. I like that she didn't try to make one slot per item. I just feel like it is a kind of a waste of space. And, this is her last one, right? And usually for the last one or two, I usually say put some sort of hobby. And I think for her, she said, other than taking walks, which isn't really like a hobby, she was able to include a lot of other things. So we kind of just put them all together into one as like an achievements section. And so you can see, like, we didn't really put the number of times spent because it was all throughout different ones. And in total, I think because she counted her thesis, which I think was required for the citation, that's where the hours came from. One of the interesting things here is the publication. So one of the most common questions is like, how many things do I need to publish to get into med school, right? And for me, I always say none, right? But people usually don't believe me. So she has one publication, which is pretty good. I feel like it's actually more than most people have. Most people don't really have publications. But do I really think this like made or broke her application? Not really. And she actually worked on a different study as well, which actually was published halfway into the cycle. So after she already published this.
In some of the update letters and letter of interest, we did talk about the publication, and the letters of update are a great place to talk about anything that you've been working on during the time of application that may not be on your application. And she does have it listed on her experience, but kind of if there's anything else that can be added, then that's a great place to put it in your letter of update.
So now the big part that everyone wants to know, probably other than GPA and MCAT, is what goes in a personal statement, right? What does an Ivy League personal statement look like? So I am all for a dramatic hook. I think if you watch enough of these videos, you'll probably know that by now. So I just love drama, apparently. And this was something that I think the first time she told me, I was like, this has to be your hook. Like, usually I like to wait until the end to think of like something, really spicy, but this was like, it just like came to me, right? And so, as a woman, I can tell you, periods do not bring me any joy at all. And so that's why I thought this was such a like fun, interesting intro, because it's kind of the opposite, right? Like, why does, if I read this, I'd be like, why does this girl love her period? right? Because as a woman, I don't love my period. And so her big story was about amenorrhea, which if you don't know what that is, it's if you don't get your periods. And, so for her, this was something that she struggled with for a long time, right? When you're 15, it's kind of like the cutoff age when it kind of becomes abnormal. She really struggled with this, and it's something that she still continues to struggle with. And, she went to different doctors. At some point, she told me she was like taking birth control pills. And I was like, why were you taking birth control pills? And she's like, I don't know. I just thought like I had to. And no one really explained the process to her. And so when she finally met someone who took the time to listen to what she was complaining about and actually took some time to educate her, and they talked about like the hypothalamus pituitary axis, she was like, that was, I think, when everything changed for me. And so that's why we wanted to include that story as one of the main ones. And she talked a lot about, how this type of visit, even though it was one visit, really changed the way she perceived medicine. And it really influenced how she wanted to practice medicine in the future, right? She said it was very like inclusive and open. I felt like I could ask him anything. And, that speaks a lot to what kind of doctor she's going to be, right? You can tell like this girl is going to be a great doctor because she's going to listen to what her patients have to say. And she talked a lot about advocacy in regards to her amenorrhea as well.
Mm-hmm. And just to bring it up once again, we see the theme of women's health coming up. So it's really this thread running through the whole application. And it shows that she chose the activities that she engaged in because she was interested in them and not just for a check on the resume. So those kind of consistencies put together make a consistent application.
Yeah. Another interesting thing too is I was, again, you can tell I'm very wary about a lot of things, but I was a little wary about, when she talked about how she may never be able to have a child. And I was like, well, what's the significance of the story? Because are you including it because you feel like it's important, or are you including it because it's actually significant to your medical journey? And she said it's actually the latter. At 15, if you're told like you're never going to be able to have a family, like that's a very like heavy thing that weighs on you, right? Like most 15-year-olds don't really plan to have a family. So she was like, the fact that that door was even shut before I had a chance to think about it was just so overwhelming. And she was like, for me, that was a lot of my motivation of why I wanted to go into medicine, because a lot of the times doors shut on you when you don't have a choice, right? It's not like you did something bad and then now the door is shut. It was, I was literally existing, and then, now I'm being told I can't have a family. And she's like, I just feel like I can relate so much to people who are not able to have families. So a lot of her motivation for going into medicine had to do with like the endocrinology, and she was really into the sciences, but also how the sciences could be applied into patient care, right? And being there for those types of patients. So again, another thing that came around again is the public health internship. And I think I already mentioned what story she talked about. It was, I think this one was specifically about the food. And she was very shocked because she, I think in Dartmouth, you're kind of in a secluded area. But then when she went to Boston to do this, she was describing like the streets, like kind of riddled with like used needles, and she had to like be careful of where she walked. There was like, McDonald's and Burger King nearby, but there wasn't like a lot of places with fresh foods. And if there was, it was quite expensive. And she talked about being a role model for these kids because she's like, how can I be that person who says, eat healthier, but then I'm picking up a burger from McDonald's on the way here. And so she was like, I had to be very mindful because I wanted to set a good example and like encourage them that they could do this, right? And so that means she had to take those measures herself too. And the last story was one from her clinical experience. So, I've been asking why Stanford didn't make an appearance. And so Stanford finally made an appearance here. And she talked about working with an Alzheimer patient and how difficult it was. So the patient basically yelled at her. And this was like so traumatic because this is like the first patient she talked to one-on-one as part of like her clinical research. And so she entered the room and they automatically start yelling at her. And she was like, I was just like terrified. But then she talks about, how she gave them space and then she came back and, she cracked a joke. I think the joke was like about like how many like leads they had on them, like I think from the EEG. And so I think once she made that joke, the patient laughed. And, anytime you can make a patient laugh, it really does disarm them, right? And so they were able to get to know each other a little bit more. And after she felt like they had a good connection or at least a good rapport, they were able to talk more about like what the study entailed. And she was like, as one of my first patient encounters, like it's so hard to understand what patients are going through, especially when you're not going through that at that same time. But she learned a lot about patients and how to communicate with, patients with dementia or patients with different neurological issues. And I feel like that story kind of seals the whole thing together, right? So in the first story, we talked about her personal experience. And then the second story, we talked about, what kind of surprised her about the culture of medicine, right? We're like, what kind of populations are we going to be serving? And then the last one showcases, her ability to do patient care. And so I feel like it just paints a really nice journey of how she started her interest in medicine and things that she did to grow that interest. And along the way, it also shows like how she would be as a doctor. And so at the end, she talks about, what her goals are and, how all of these things, not just one thing, right? It's really a culmination of things, how these all influence her practice for medicine and what she plans to do with her degree. And I feel like oftentimes, people always ask me like, how do I conclude it? And I'm like, you always have to put your goals. Like people don't talk about their goals enough. And I was like, so if you have no goals after going to med school, why are you going to med school, right? You have to have a plan. And that plan has to just be beyond treating people, because if you just want to treat people, you could do a lot of different things in medicine that don't take 8 to 12 years, right? You could do a lot of treatment things in a lot less time. So in the end, we really emphasized what her goals for medicine was. We talked a little bit about her specialty that she was interested in. And that was something that we were very careful about, right? You don't want to say, I'm going to do endocrinology and women's health. It is the end all be all. Like I will not do medicine otherwise, right? And a lot of things like come off that way. Like we always joke, like for orthosurgery, right? People who say I'm going to do orthosurgery are like not open to anything else. But with medical school applications, you have to be open for everything. Without doing clinical rotations, how do you know that that is it for you, right? You can have an interest, right? You can have an interest in orthosurgery and pursue that in med school. And then once you come out of rotations, if you love it, great, right? But I have so many friends who they're like, I definitely want to do this specialty. And, by the end of it, it's like completely different. Like one person at my school, she was going to be a neurosurgeon all throughout med school. And guess what specialty she applied to?
Pediatrics.
It applied to pediatrics.
It's just the complete opposite.
Yeah. And I was like, oh my God. I was like, that is literally the biggest shift, So anyways, in these applications, like med schools know you're going to change your mind, but if they feel like you're not going to be open to anything else, you may not be as strong of a candidate regardless of what your successes are.
Mm-hmm. You have a lot to learn, and I think it's important to show that humility in your application as well.
Now that we've seen the entire application, what schools did she get into? So in the end, she had 8 interviews, which I thought was a huge success. And I think she applied to 46 schools, if I remember correctly. So 8 was pretty good. It was a balance between MD and DOs. And I guess we're still in the middle of the cycle, but in the end, she got waitlisted at UCSD, and she has 2 acceptances to Dartmouth University and Tufts University. So what do you think made her successful?
I think, as we kind of alluded to throughout this whole time, she really had a lot of passions that she went for and took initiative to go after her goals. And that came across in her activities, in the ones that she chose as the most meaningful, and throughout her secondaries. And I think a really important part when it comes to the secondary applications is reflecting and thinking about what stories puts your best foot forward. What is going to tell the story of you so that the admissions committee can make an informed decision and really get to know who you are to the best of their ability. Something else that's just more on the logistics side is timing. So getting your application in early is super important, especially when it comes to secondaries. I try to keep a rule of thumb of about 2 weeks max turnaround time. So getting the secondaries in as soon as possible once you get them is so key, because admissions are typically rolling. And so the more writing you can do up front before you even start to get those secondaries, the faster it's going to make your turnaround time, and you can still produce high quality work.
Yeah, oh my God, secondaries is like a dating game, right? How like if you go on a date and then someone doesn't respond, you're like, oh, they ghosted me, right? Well, that's how admissions is. If they send you a secondary and then you don't respond for a month, and then you like all of a sudden pop up, it's like, it's like the you up text. It's like, hello, I'm still here. And they're like, okay, well, we have a ton of other people who are interested, so why should we pick you? And, it really is like a timing game. Like once they send it to you, if you can get it in under a week, you're going to show them or at least make the admissions committee feel like, we are your top priority, right? And it shows that you are excited about them, because they know you're applying to a ton of schools. They know you have 1,000,001 secondaries. But if you're able to show them, and again, this is all like because you've pre-written them, right? Not because you are actually prioritizing them. But if you send it in early, it shows that you want to go there, right? And, does it make a huge difference? Maybe not the biggest difference, because they still have to look at your application as a whole. But, if they're kind of teetering between you and someone else, and you sent it in, within a week, and someone else sent it in a month later, they're going to think that you're more interested than the other person.
Mm-hmm.
I think one of the most interesting things is her stories. Throughout the process, she was very adamant about staying true to herself. And that is something that I feel like you and I like always encourage, right?
Yeah.
My philosophy is like, if you don't like it, then don't put it in.
Don't do it, don't say it.
Yeah, exactly. And so obviously, like, I have a lot of opinions, you have a lot of opinions, she has a lot of opinions, but I'm like, in the end, this is her application, and what she thinks represents her the best is what she should put out, right? Do you want to go to a school that doesn't like who you are as a person? No. Like, you may get in, but you may not be happy there. And so, it really is about a good fit, right? And so I just think it's such an interesting thing to hear, people's stories that are not necessarily represented in the application. Like, I mean, how many times did I talk about Stanford and why she didn't pick that, right? But in the end, she showcased not the research part, but the clinical aspect. And I think that was just such a smart way to approach that, because guess what? The Stanford name is still going to be in the application, but we got a really good sense of what her personal qualities are. We got a good sense of her journey. We got a good sense of who she is as a person, what she's passionate about. And that really is what's important in a application, right? I see so many people with better grades than her, a better MCAT than her, right? More research, believe it or not, more publications, more volunteering, right? Gap years where, they worked at some really cool place or did something really awesome. And, I see these same people applying 2 or 3 times without any success. And why is that? The writing is really what it comes down to, right? And I think people don't understand the emphasis on the writing. And, you can talk about, I did X, Y, Z, I did research this, research that, I published this, and, I don't know, I cured cancer along the way. But if there's no purpose behind what you're writing, it's not going to come across, right? And it's just going to look like, well, I did a bunch of things and all of these things are just check boxes. But guess what? In medicine, how many people drop out because they actually don't like it?
So many.
Yeah, I have a lot of people from my school who are not in the program anymore. And, sometimes it is because they just realize like it's not what they want to do. And I always thought that that was kind of such an interesting thing, because you work so hard. I guess for me, like, because I spent so much time like thinking about it, like when I told my parents I was going to do a gap year, oh man, like that, telling an Asian parent that you're going to do a gap year is like the end of the world. But, for me, I was like, I want to make sure, right, that I really love this before I commit. And, when by the time I applied, I mean, I was like a nervous wreck, but I felt like I did the best I could. And I was very confident in, what I wanted to do in medicine. And I feel like that came across in my own application. And that's what I see here, right? I feel like she took a lot of time to explore different things. I think the public health internship actually was like such a unique thing because it wasn't so medical, it wasn't so clinical, right? It wasn't just research. And it's something a little bit different that made her application unique.
Yeah, absolutely. And I think that when you do approach your application with sincerity and showing your own personality, it really comes through. And admissions committees can see through when you're just trying to check a box or when you're just trying to do something to go through the motions. And if it doesn't come through in your application, it will come through in your interviews. So being true to yourself is really so important.
So that's all we have for today. If you like this content, please like our video and subscribe and let us know what you think about this application. We're going to try to put out a lot more content just like this, so stay tuned.